everyone. For learning outcome 4, we're going to be talking specifically about the penis. The penis is the male organ of copulation, which basically means that it's the organ of sexual intercourse, and it will be depositing the semen into the vagina of the female reproductive tract and also conducting the urine to the exterior. The penis is this tubular organ that contains the distal portion of the urethra, more specifically the spongy urethra. And the penis is going to be divided into 3 regions. The root, which is the fixed portion of the penis. The body, which can also be called the shaft, which is the movable portion of the penis. And the glans, which is the expanded distal end that surrounds the external urethral orifice or the opening of the penis. Now don't get glands confused with glands with a D. So the tip of the penis does not have a D on it. So it's glands without a D. Lastly, we're going to have a fold of skin, which is called the prepuce or foreskin, that surrounds the tip of the penis. Around the prepuce, there are these preputial glands that secrete a waxy material known as smegma. And unfortunately, smegma can be an excellent nutrient source for bacteria. And mild inflammation and infections in this region are common, especially if the area is not washed very well and frequently. And one way of avoiding these problems is to perform a circumcision and surgically removing the prepuce. And in Western societies, especially in the US, this procedure is usually performed shortly after birth. And although controversial, continuation of this practice is supported by strong cultural biases and also epidemiological evidence. Uncircumcised males, they do have higher incidence of urinary tract infections, and they are at greater risk for penile cancer than circumcised males. So on this image, we can see how the circumcision is just removing the foreskin, so the prepuce around the glands of the penis. The penis contains erectile tissue, which is composed of numerous blood sinuses or vascular spaces that are going to be lined by endothelial cells and surrounded by elastic connective tissue and smooth muscle. And in the shaft of the penis, there are 3 masses of erectile tissue. 2 upper masses are called the corpora cavernosa, and the singular is the corpus cavernosum, and 1 lower mass, which is known as the corpus spongiosum, which surrounds the spongy urethra. And on an anterior view, where we have sectioned the penis, we can clearly see the 2 corpus cavernosum, so the corpora cavernosa, sitting superior to 1 corpus spongiosum. And on this mid-sagittal view, we can see the corpus cavernosum superior to the corpus spongiosum. And when it swings around, it becomes anterior to the corpus spongiosum. And this can be a little confusing because it does seem like there are 2 spongiosum and 1 cavernosum on this mid-sagittal view. But remember that the spongy urethra passes in the middle of the corpus spongiosum. So it does divide it into 2 portions, but it is really only one structure, as we can clearly see from this image on the right. Also notice how the corpus spongiosum starts at the base of the urogenital diaphragm and it extends to the tip of the penis, where it expands to form the glands. Here we're going to be talking about the erection reflex. So upon sexual stimulation, the penis becomes enlarged and stiff, and this phenomenon is known as erection. An erection is a parasympathetic reflex that's going to be coordinated by the spinal cord. During an erection, the parasympathetic nerves that extend from the sacral portion of the spinal cord to the penis, as we can see over here from this image, they will release nitric oxide. And the nitric oxide causes the smooth muscles in the walls of the arterioles supplying the penis to relax, therefore to dilate. And this will allow large amounts of blood to enter the blood sinus of the erectile tissue. And the blood sinuses will expand, and this will cause the veins that drain the penises to be compressed, which slows the blood outflow of those veins. Therefore, the combination of dilation of the penile arterioles, the expansion of the blood sinuses, and the compression of the penile veins results in an erection. A major stimulus for erection is mechanical stimulation of the penis. So mechanoreceptors will provide direct input to the erection integrating center in the spinal cord. Also, erotic sights, sounds, smells, and thoughts can also stimulate erection, and this involves descending inputs from the brain, which include input from the hypothalamus and the limbic system, all the way to the spinal cord. Of course, negative stimuli, for example, if a person is in a bad mood or a person is undergoing depression or anxiety or any other form of a negative stimuli, this can also inhibit erection through these descending pathways. Ejaculation, which is the powerful release of semen from the urethra to the exterior, is the opposite. It's going to be a sympathetic and also a somatic reflex that's going to be coordinated by the spinal cord. And when the sexual stimulation becomes intense, the sympathetic nerves from the upper lumbar portions of the spinal cord will stimulate contraction of the smooth muscle in the walls of the epididymis, the ductus deferens, and the ejaculatory ducts, causing the sperm to be propelled into the urethra. In addition, the sympathetic nerves, they will stimulate the accessory sex glands to release their secretions. Therefore, semen is going to be formed as these secretions will mix with the sperm. Now, the movement of semen into the urethra is referred to as emission. Then the somatic nerves from the lower lumbar and upper sacral portions of the spinal cord will stimulate the contraction of the skeletal muscles at the base of the penis, and this will cause the semen to be propelled from the urethra to the exterior. And as part of this ejaculation reflex, the smooth muscle sphincter at the base of the urinary bladder will close. And this does two things. It prevents the urine from being expelled during ejaculation, and it also prevents the semen from entering the urinary bladder. We have already mentioned before that the volume of semen in a typical ejaculation is between 2 to 5 mLs, therefore an average of about 3 mLs, with also an average of 100 million sperms per ml. Therefore, this will make a total of 300 million sperms. When the number of sperms falls below 20 million per ml, the male is likely to be infertile, meaning that they do not produce enough sperm count to be able to procreate, be able to reproduce. And why does the sperm count need to be so elevated? Well, a very large number of sperm is required for successful fertilization because only a tiny fraction ever reaches the egg. And when we cover the female reproductive system, we will see all the obstacles the sperm encounter on their way to fertilization or on their way to meeting the egg. Now, once sexual stimulation of the penis has ended, the arterioles supplying the penis constrict, and the smooth muscle within the erectile tissue contracts, making the blood sinuses smaller. Therefore, there is less blood reaching the arterioles. In addition, this relieves the pressure on the veins supplying the penis and therefore allows the blood that is in those veins to drain through them and therefore leave the penis. Consequently, the penis returns to its flaccid or relaxed state.